Hello, my name is Giselle Zendejas. I'm a student physical therapist assistant. And then today I'm just going to be answering week 2, exercise number 1 for the patient that had a coronary artery bypass graft twice, and that is in the acute care setting. So, to answer the first question about the 5 benefits of early mobilization for a patient, one of the benefits of early mobilization for a patient would be preventing anxiety and depression. Because sometimes when the patient, or a lot of the times when a patient has a very big surgery and just being in bed, it can kind of bring our mood down and it can kind of make us a little bit sad. So, physical exercise has been shown to improve a person's mood and just help with anxiety and depression if it were to develop. Another benefit of early mobilization for our patient is the fact that early mobilization would increase their cardiac output of the heart, which in turn would improve blood flow and nutrients to the muscle because the heart is pumping more and it's causing for more blood flow and nutrients to go to the muscles, therefore enhancing and helping with the recovery process. Another very important benefit to early mobilization would be decreasing the risk of any pressure injuries or pressure ulcers developing, as staying immobilized, especially staying immobilized in bed for more than 2 hours, it can increase the risk of our patient developing any pressure injuries and the skin just breaking down over time. The fourth benefit of early mobilization would be reducing the risk of contractures that can develop in muscles. So let's say, for example, our patient is just immobilized in bed for, let's say, a week, 2 weeks. They can develop certain contractures, as with if we were to mobilize them, this can just help reduce the risk of contractures because we have them moving, we have them bending their joints, and they're just not stuck in a prolonged position for a long time. And the fifth and final benefit of early mobilization is just reducing the risk of deep vein thrombosis because it has been shown that for a patient to be immobilized for a very long time, it can increase the risk for deep vein thrombosis. And moving just gets the heart going, the blood flowing, and just reducing that risk overall. Now, to answer the second part about the 5 important things to consider or questions to ask yourself before beginning mobility with this patient, one thing that I would consider definitely is going over the sternal precautions provided by the medical doctors, even though for the most part the sternal precautions are all very similar. They can vary depending on the medical doctor. So even though I might assume that they're all similar, the medical doctor could provide extra sternal precautions that aren't seen regularly. And I just want to make sure that I'm not violating any before conducting our physical therapy session with the patient. The second thing that I want to consider while with this patient is checking their white blood cell count. Because depending on their white blood cell count, whether it's very low, this can be a contraindication to physical therapy, and it could mean that they are fighting an infection and they would not be appropriate for therapy. Or if their white blood cell count is very extremely high as well, this would also be a contraindication to therapy, and we would not be able to proceed. Another important thing that I want to consider is where the radial artery graft was taken from. So let's say, for example, it was taken from his left side for his coronary bypass artery graft surgery. This would mean that I would not be able to take blood pressure on his left arm, as they would have an incision and this could just hurt the incision and make it worse for them. So then that would mean that I have to take his blood pressure on the right arm. So this is another important thing to consider. Fourthly, another important consideration that I would take into account is his rate of exertion. So since he's in the acute phase, I don't want him to be too fatigued, and I also want him to understand what level of fatigue or exertion that I would want him on. So the scale that I would use would be the RPE scale, and then I would explain that I want him to a 2 to 3 on the RPE scale, which is light, not too light where it's like he's watching TV, but light, moderate activity where he can hold a conversation, but it's to the point where he does feel a little bit of that fatigue. And then I would just explain the rest of the scale because I want him to understand what exertion I want him. So that way, if he's feeling like moderate exertion or very high exertion, then he knows that it's too much and he's able to tell me. So then I can therefore modify our therapy session. Lastly, I want to confirm any precautions and contraindications before beginning mobility with the patient, as if there are any contraindications, then we can't proceed with the session. So this would be making sure that he doesn't have any unstable angina, which is like, any unstable chest pain, symptomatic or uncompensated heart failure, uncontrolled arrhythmias, moderate to severe aortic stenosis, uncontrolled diabetes, uncontrolled resting tachycardia, and then if he has a resting blood pressure of greater than 200 millimeters to 110 millimeters of mercury. Now, lastly, to answer the last question of how I would clearly and respectively explain sternal precautions to our patient, is first I would inform the patient that since they have just recently underwent a double coronary artery bypass graft, that they are in the early stage of healing, and being in this early stage of healing comes with its own set of precautions that need to be followed in order to ensure a safe and swift recovery and to also prevent from his incision from reopening. I would then inform him, I would then go by telling him the list of precautions. So some precautions that are given for that are given to sternal precautions are limited driving. So this would mean that the patient would either have to find a family member who's willing to help them drive, possibly order Uber Eats or grocery deliveries, or even possibly get a bus pass to just help him because his driving is going to be very, very limited. And then I would also explain to him that when he feels like coughing, sneezing, or laughing, that he's going to need to splint. And then I would explain to him what splinting means is that you would grab a pillow, hold it against your chest so it provides stabilization and counter pressure when he's coughing to reduce any pain or discomfort. And then another important sternal precaution that I would tell him is that when he's sitting down and when he's going from sitting to standing, he's really going to have to try and focus on using little to no of upper extremity use, as this could open the incision and some of the force from the extremity. So for example, when you're pushing down or when you're pulling on something, this can possibly like open the incision. And then another important precaution that I would tell my patient is that when they're laying in bed, they're going to have to avoid flexing their trunk or rotating it. And let's say, for example, our patient doesn't understand what flexing the trunk means, then I would just show him by saying, like, for example, when you're doing crunch flexing, so he wouldn't be able to do that and to not rotate his body as well. And then also, I think when explaining this certain precaution about not flexing your trunk or rotating your trunk, I think providing an alternate way of going from supine to sit is appropriate. For example, we can teach our patient how to do the log roll, as that would be appropriate as the patient isn't flexing the trunk or rotating the trunk. Excuse me. And then another important precaution that I would explain to my patient is not retracting their shoulders more than normally. And then I would just demonstrate that by showing the movement, as sometimes they might not understand, and it's better to show it. Another precaution that my patient has to know is they're not able to lift, push, or pull objects greater than 10 pounds. As doing this can open the incision because we have a lot of muscles that attach to our chest region that involve in pushing and pulling, and this can just lead to the wound reopening. Another important precaution I would tell my patient is to avoid shoulder flexion greater than 90 degrees when weighted. So essentially, I would just break it down to my patient by saying shoulder flexion is going like this, and they're not able to go past 90 degrees. So this is 90 degrees, and they're not able to go past that when holding something weighted. So for example, let's say they're holding a box, they're holding their pet, their cat, their child. They're not able to go past that 90 degrees while holding that amount of weight. And then another important precaution or another piece of advice that we would give our patient that's included here is try to do some active range of motion with the shoulder, but within a pain-free range of motion. So I would tell my patient that what active range of motion is that you're actively contracting the muscle. So that means that you're not holding any weight, you're not like doing resistive exercise, you're just actively contracting the muscle. And remember that when you're doing these motions, you don't want to feel any pain. So let's say you're actively contracting and you feel pain like around 30 degrees, then you want to stop. You don't want to keep pushing it, as that's just going to delay your healing process. And then two examples of functional activities that I would show my patient that are within the sternal precaution list are, for example, the precaution about lifting, pushing, or pulling, like anything more than 10 pounds. That would mean that my patient isn't able to hold any grocery bags, as those heavy grocery bags could be pulling on his arms and pulling on those muscles that attach to the chest and could lead to the incision dehiscing or opening. Lifting heavy laundry baskets, lifting up your kids, picking up your pets, any type of movement like that is a no-no. And then another functional activity that I would inform my patient is, since they're not able to retract their shoulders more past the normal amount, this means that putting on your bra, putting on a coat, or even like scratching your back, any type of like movement like that is a big no-no, as this also can lead to the incision site opening and leading to the dehiscence.